And because I've been in and out a little bit, I may be a little bit repetitive, and apologies in advance if I am. But I want to start with a question to you, Dr. George. To detect biological threats, the Department of Homeland Security has mainly focused on directly detecting airborne biological agents through its BioWatch program. However, BioWatch is only able to detect biological agents from a limited known library of threats, which leaves a critical blind spot in our detection system, especially since naturally occurring disease outbreaks and accidental releases are likely to consist of previously unknown biological agents. The department is attempting to replace BioWatch with a new program, but the readiness, as I understand it, of that technology is still really years away. Dr. George, can you speak to what a successful biodetection program looks like and how current federal programs fall short?
Yes, Senator. So a successful biodetection program has a number of different kinds of detectors within it and spread all throughout the United States, at least for our nation. It's fine to have the BioWatch detectors if you can get the equipment to the point where it's actually detecting what it's supposed to.
Right.
But you're absolutely right. We are facing so many other threats than just the handful of threats that BioWatch was supposed to pick up on. So you also need other pieces of equipment. So for example, you could have particle detectors that aren't looking for specific agents, but are looking to see how many particles are in a particular room or an area. And can note that, hey, suddenly we're seeing a whole bunch of something or a whole bunch of virus in this one place. What is that? And send the alert to somebody else to go take a look. We also have, there are handheld detectors. There are all kinds of detectors. There are detectors you can put inside, detectors you can put outside. I think we need a vast panoply of those spread out all over the place and gather all that information together, because if you look at how we detect disease anyway, whether we have a detector or not, we're always drawing on a number of pieces of information. Hey, there's something going on over in China. Oh, look, somebody's in a hospital now. This seems to be unexplained. Medicare has some things to say. CVS is suddenly reporting that everybody's running in to get certain medications from them, and so forth. That's how you would put together such a system.
Really collecting a cross-section of data, each of which is signaling,
Right.
A particular proof point, and doing it in a broad range of areas.
Yes.
Yeah, okay. This is a question to Mr. Curry and Dr. Parker. One way that we can detect biological threats is screening patients at hospitals and other healthcare facilities. And there was just a discussion as I came in with Senator Portman on this issue of what kind of data do we have. But as I understand, much of this data would be collected by non-federal entities. So federal agencies would need to closely coordinate with them. Unfortunately, as the Government Accountability Office reports, the current National Biodefense Strategy does not assess non-federal biodefense capabilities, nor does it establish a mechanism for better coordination with non-federal entities. So, Mr. Curry and Dr. Parker, how can the federal government ensure that its non-federal partners have the capabilities to detect and collect information on potential biological threats? And how can Congress act to better coordinate federal and non-federal efforts? And I'll start with Mr. Curry, and then we'll go to Dr. Parker.
Thank you, Senator Hassan. I couldn't think of a better example of a lesson learned from COVID-19 than better coordination with non-federal entities. I mean, we saw this with not just issues related to the strategic national stockpile, but how supplies are distributed throughout the country. That being different in every state, it just perfectly encapsulated the challenge there. So, I mean, in my view, the thing that we can do, Dr. Parker said earlier, made a great point that we have these lessons learned that we've seen in COVID. We've developed these monitoring systems, these tracking systems, these coordination mechanisms. These need to be formalized. We need to execute and implement these formally post-COVID for the future. And I think that may require, because this issue crosses committees of jurisdiction, it crosses federal departments, that will likely require legislation and other actions to do that formally.
Yeah. Dr. Parker.
Sure, and I'll just echo that and add on in a couple examples. I know in HHS, I observed firsthand during COVID response, the establishment of the supply chain control tower that was able to link SNS with all the private sector and get visibility of the supply chains, and that would able to focus, actually anticipate where supplies were going to be short. And then that evolved into the healthcare control tower that similarly could really anticipate where there were going to be shortages in a hospital system somewhere in the United States, and shifts could be made in coordination with the federal government and the private sector so they could be working in unison. So we've just got to figure out how we can tap those lessons observed and turn them into lessons learned. And it may not be something that's practiced on a day-to-day basis, but when there's a crisis, we have to be able to turn those data informatic pipes on so that we can have that coordination between the appropriate federal and state and local
Yeah.
authorities and the private sector partners.
Yeah, no, I mean, we're a system of federalism. We need to be able to apply that when we're talking about data sharing as well. To Mr. Curry, the Strategic National Stockpile should be a critical tool for responding to biosecurity incidents by quickly providing medical supplies to aid in the response. What are the most significant challenges when it comes to managing the Strategic National Stockpile?
Well, ma'am, since COVID and really well before COVID, we've had a number of concerns about the Strategic National Stockpile. Before COVID, we were actually concerned about the way it was funded sporadically and what that might mean in terms of its readiness to handle an event like this. As you know, in the past, it was used to handle more localized events like H1N1 or Zika or things, where you needed to target a specific area of the country or a specific smaller population. Of course, in COVID, we needed it nationwide, and it wasn't ready. So I think one of the biggest challenges that we've identified is just the lack of understanding at all levels of government, including across the federal partnership, about how this stockpile is distributed and procured. Procurement was an important piece of this because you can't keep enough things on stock or in a warehouse to deploy throughout the whole country. So you have to be able to procure up and acquire those things when you need them. And we just weren't ready to do that.
Yeah. Well, thank you. Given these challenges, I'm committed to working with my colleagues on this committee and on the Health, Education, Labor, and Pensions Committee to pass provisions that we have in a bipartisan bill, which is called the Strengthening America's Strategic National Stockpile Act. It already passed the House. We will continue to work to see if we can get it through on the Senate side, because I think this is an opportunity for us really to make progress and build up the kind of stockpile that would help. I hope there is not another crisis like the one we are going through right now, but we need to be prepared for it, to be sure.